Fertile Minds is a podcast brought to you by Virtus Health, who have more than 40 fertility clinics globally and in Australia, including IVF Australia, Melbourne IVF, Queensland Fertility Group, and Tas IVF. Our goal is to demystify fertility and assist you in getting pregnant faster. Over the coming episodes, we'll be sharing helpful tips and evidence-based advice around key fertility topics. So be sure to browse our episodes and subscribe so you don't miss a thing. You can also watch videos of these recordings on our Fertile Minds YouTube channel. Let's dive into today's episode. Welcome to Fertile Minds. I'm Dr. Manny Mangat, a fertility specialist at IVF Australia in Sydney. A little bit of background about myself. I started as an obstetrician and gynecologist, and then I did further training to specialise in reproductive endocrinology and infertility. This then made me one of 80 or so subspecialists, board-certified fertility specialists in Australia and New Zealand. I have then done training in male fertility as well, and this allows me to manage almost every aspect of my patients and their partners together. I have been now treating couples for about 15 years and am passionate about what I do. We're very lucky today to be joined by Dr. Samir Mathur. Welcome, Samir.
Thank you, Manny. My name is Dr. Samir Mathur. I'm a board-certified obstetrician and gynecologist, and I'm a fertility specialist that works with IVF Australia, also here in Sydney. I'm really excited about today's topic. We're going to be talking about how to get pregnant in your 40s. What are the kind of fertility treatment options that are available to women? And also a little bit about the implications of pregnancy for women over 40, because I know, Manny, that that's a concern for a lot of our patients.
Before we delve into further detail, we're going to kick off today's episode with our Fertile Fast Five. Samir and I will answer 5 fertility questions so that you, our listeners, can get to know us a little bit better. Samir, what sparked your passion for fertility?
I remember, Manny, when I was in gynecology training, a good friend of mine who was in a same-sex relationship actually came to me and said, what do you know about falling pregnant with donor sperm? Admittedly, at the time, I actually didn't know a whole lot about it. And so I'd connected them with a good friend of ours who did. But it kind of took me into a bit of a deep dive into, donor pregnancies, and invariably you end up in the Reddit forums, which are, the source of all wisdom on the internet. But what I found was reproductive medicine is at this intersection between ethics, medicine, surgery, and it's constantly been pushing the envelope. And I think that's exciting, that's interesting, and to be part of that is something I really enjoy. Manny, what is your most memorable fertility moment?
Samir, as you said, fertility is an exciting space. It is a privilege to help my patients create families. I feel every moment is memorable. From a day-to-day basis, patients see you having been through a lot. And as you said, they've tried to look up their own information online. They've been through sometimes a long journey. They've seen other specialists. They've been to other clinics. But when all your ducks line up, and I call them with that positive pregnancy test, it's priceless. And you do your pregnancy scan, you see that heartbeat, again, no words. And finally, almost daily, you get these emails from patients with the baby in their arms, and the joy is palpable. So to me, I feel even after 15 years, every moment on a day-to-day basis is memorable, and I'm so lucky. Now, Samir, what is your favorite part of being a fertility specialist?
Manny, I totally agree. For risk of sounding a bit tired, but I agree that when you get that nurse's phone call to say that your patient has a positive pregnancy test, you get a big dopamine hit. 10 minutes later, you call the patient, tell them the news, hear them either cry or scream, and you get your second dopamine hit. So being able to be part of that, especially when we know that these are patients who typically come to us, anxiety levels 15 out of 10 often, and being able to be there when that happens, that's a really, really special part of our job. I'm sure you'd agree with that. What do you think is the most important advice that you give to couples who are undergoing fertility treatment?
I think it is really important to remember that you're in this together. There are two parts to the fertility journey, you as well as your partner. Whether this is your male partner or a same sex relationship, support each other. You've got this. My second key point is you can do whatever you can to put yourself in the best place for your fertility journey. And that's whether it's getting healthy with your diet or increasing your exercise, um, eating well, reducing alcohol, ceasing smoking, and taking something simple like folic acid and iodine for the woman, and maybe a male fertility multivitamin for the man. My final piece of advice is stay positive because, as we've said earlier in this podcast, the journey is not always easy and there are ups and downs. Success rates are not always 100%. Not everybody walks away with a baby, especially in the age group we're talking about today. So you have to stay positive and be in it for the marathon that is sometimes the journey. And by doing that, I think it's important to work with a fertility specialist that you trust and feel comfortable with. Someone you feel is up to date, understands your circumstances, and has experience in your individual situation. Samir, what excites you about the future of fertility?
I would say that, Manny, day by day, our understanding of genes and broadly the genetics that underpin various diseases, but even just the traits that make us human, day by day, that knowledge is growing faster and faster. In some ways, it's approaching a time where, it's got a bit of a Gattaca-esque feel to it. I don't know if you remember that, movie, but I feel like it's not a matter of if, it's now approaching a time of when that kind of reality is something that we're going to be seeing. And being at the coalface of it as fertility specialists, I feel that it's exciting, it's scary, but it always goes back to exactly what reproductive medicine has been doing since its inception, which is it's pushing the envelope. And to be able to be part of that, amazing. And that's super exciting.
That's great, Samir. I agree with all the points that you've brought up. But I guess what we need to remember is that even though we have the power of pushing the boundaries, pushing the envelope, becoming a Gattaca, I still think it's our role to also be the gatekeepers, to use the technology that gets our patients pregnant as soon as possible, to help our patients with new advancements in genetics or in treating older patients or in better technology for our embryos and their development in our embryoscopes. However, we should always remember to do this in an ethical and safe fashion. Each episode will break down the headlines and discuss the latest news in fertility. You may have heard the term baby recession in the media recently. What is that? And what could be causing this trend? The estimated number of births in Australia last year have reached an all-time low since 2006, and this has led some experts to declare a baby recession. Some claim that the decline in birth rates could be due to economic factors. We all know that in Sydney, housing pressures, cost of living, it's causing people to possibly delay their plans and delay having their families. Experts predict that it could take some time for birth rates to start increasing again and reach the fertility rate needed to maintain a stable state of population in Australia. I mean, I think this is pretty alarming. And as we know, the average age of first time mum has now reached 32 years of age. And if people are having their first baby at 32, by the time they end up at their second or possibly even their third, they're more than likely going to be over 40 years of age. What do you think, Samir?
The trend of declining births and the fertility rate at large is by no means something that's unique to Australia. We certainly see across developed countries that's something that we see, across those countries. And in fact, Australia, to some extent, is probably the middle of the pack when it comes to our fertility rate. Now, I think, there is definitely an argument for economic factors. But even in countries where we see that economic factors are attended to, or not as severe as perhaps in Australia at the moment, that declining trend continues. And certainly when we look back at data over the last 40 to 50 years, we can see that the declining trend has been something that predates the current economic pressures that a lot of households do face themselves in. That's not to minimize the economic impact. I know that in Hungary, for example, if a woman has 3 children, she pays both her and her husband pay virtually no tax. And I think these, Manny, are just some of the, levers that the government can pull if the issue becomes dire enough. At the moment, some of the softer levers that the government is pulling would be things like increasing migration, which is controversial in itself. But what are your thoughts about that?
I was just going to ask you because my thoughts are, it's multifactorial. Women are possibly focusing on their careers these days. And, now COVID's over, people are traveling again. They're, putting their education or their travel or their life needs in some ways first.
Yeah.
And it's, not just the cost of living, I suppose. And yes, the government can do more or immigration, but all those things take time. So let's hope it doesn't reach dire straits. But before we progress on to the next topic, I just want a little bit more insight. So if it's not the economy and it's happening in other, countries, then what are your thoughts as to why that could be the case?
I mean, globally, what we see in developing countries, for example, is that hand in hand with female participation in the workforce and growing education of the female workforce, we obviously see those birth trends start to gradually take a decline. This is something that we undoubtedly need to support. Some of the supports that you or I perhaps could see in our day-to-day work would be, for example, there is very little support for our 30-something-year-old patients that are choosing to do social egg freezing. Perhaps that's an area that might be able to shore up people's reproductive options as they get into their 35 and 40-year-olds, So I think if you ask the average patient that comes through, a lot of them would say that further support going through reproductive technologies would be welcome. And perhaps it would allow us to just address some of those issues, which are many.
I think we bring up a few important points here today because we've also opened up our education sessions to large companies and HR departments because I think we need to acknowledge that there's a lot more that goes into the fertility journey, and it's not always the successes. There's also the losses with miscarriage support and management.
Okay.
And as Samira mentioned, as society's getting thinking about all the reasons why they need to achieve different things before they have children, I think we're very lucky these days that there is the option of egg freezing or embryo freezing if a woman is in a couple situation. So we know that egg quality declines with age, and that is probably the biggest determinant of failure, or delay in pregnancy for a woman. And if she then freezes her eggs at their quality at a younger age, so freezing them in time, it's going to give her the same success of that younger egg age when she wants to use it later. But it does it's done in the setting of an IVF cycle. And it still requires appointments and blood tests and ultrasounds and prep and time. And I feel that, as you said, that's an under sort of valued or appreciated area where we can definitely work on supporting our patients through all aspects of that journey, which will then help possibly relieve the pressure of women in their 40s coming back for treatment.
Yeah, absolutely. I can't leave the blokes out of this conversation. I remember when I had my first child and I managed to get paternity leave of 2 weeks. And any new mum will tell you, okay, what is 2 weeks? It's a drop in the ocean for the poor blokes out there who want to support, who want to be part of that process, but either financially or time-wise are not being supported to do so. And I would really love to see some more advances in that side of things as well. And some of the corporate sector in Australia are doing marvelous things, and I think that needs to be more widely adopted.
Good points. That's amazing. Now, let's delve into today's topic, getting pregnant over 40. In recent years, the number of women giving birth after the age of 40 has risen. And as we have mentioned, society is changing. More people are choosing to have their families later in life. And, people who do have their families later in life feel there are many pros to that as well. Our biology hasn't caught up with where we are socially, but older mothers usually say they feel they're better equipped to have children, they're better equipped to provide for those children, they now have time that they can put towards those children. They've matured in their life to actually give their children, all the love, attention, and finances that they deserve. So there are pros to having children later in life. But whether you wanted to focus on your studies, establish a career, travel, create financial stability, or just not meeting the right person, and let's face it, that's also becoming a growing problem, not meeting Mr. Right. Yep. So you may not have been ready to start your family for many reasons until you are in your 40s. And for women who conceive their first child easily, as we said, may still find a challenge, may still find it's taking longer, may still find that there's difficulty conceiving in their 40s. And that's simply because their egg quality has declined. And with that comes a larger percentage of abnormal eggs that contribute to abnormal or aneuploid embryos. And then that increases the risk of miscarriage. So, Samir, what are your chances of getting pregnant over 40?
Manny, I yesterday had this conversation with a patient of mine. Let's call her Angela, for example. And the information that I kind of conveyed to her is that maternal age is the biggest determinant of our chances of conception. As we get older, both male and female age, but particularly maternal age, it certainly gets more difficult to actually fall pregnant. We know that once you turn 36, for example, your chance of conceiving naturally is about half of what it was when you were 20. And at the age of 40, women have about less than 40% chance of conceiving after actively trying for 12 months. And so when I convey some of those statistics to my patients, they're quite alarmed. They're like, why did no one have this conversation with me? And I think we are having that conversation more and more. Part of also what I talk to patients about is that the reason behind maternal age is impact on chances of conception boils down to two things, both quantity and quality. With regards to quantity, we know that women are born with all the eggs that they have for their lifetime. That's approximately 2 million eggs. By the time that they hit puberty, that's about down to 400,000. And as you know, by the time we get to menopause, there's relatively few left. Now, what's actually happening there? Because if you're good at maths, which I'm certainly not, but if you do the quick maths about that, 400,000 at puberty, barely anything at menopause, 40 years in between and 12 months, well, that doesn't add up to 400,000. So what's actually happening there is, irrespective of what a patient does, they could be on the oral contraceptive pill, they could not be on the pill, a certain cohort of eggs gets discarded every month. Right? One egg goes through the menstrual cycle, sure. Sometimes families have 2 eggs, they're more prone to having 2 eggs go through the cycle. But we know that a cohort of eggs gets discarded every single month. Now, in parallel with this gradual recession of ovarian reserve is that we know that the quality declines. I mentioned earlier that we are born, or women are born with all the eggs that they're ever going to have. And be it the pollution in the air, be it the radiation from the flights they take, be it from nothing at all, those eggs acquire gradual damage over the years of being within the ovary, such that we know that as women start to get towards 35, that damage manifests itself as what we call chromosomal or genetic variations within those eggs. And that's why we see, for example, you touched on earlier, higher rates of miscarriage or other issues as well. And but look, it's not all doom and gloom. There's some interesting studies I was reading the other day that women that have children older in life are tend to be happier. They tend to actually, in fact, live longer. Yeah. And the children, some studies are showing, may be more well-adjusted in school as well. So I think we always focus on the doom and gloom, but it's important to highlight those really good aspects about having having children later in life as well. What are your thoughts about what are some of those risks of pregnancy over 40, Manny?
Samir, before I explain the risks of pregnancy over 40, I also read that study about older mothers. And having had my second baby over 40, I was very excited that I'm going to live longer. Now, with regards to the risk, I think as we've said, the biggest thing is that our eggs they wait for no one. So even though you look 20, you exercise, you have an amazing diet, you do everything you can to, follow the new wave of anti-aging medicine, unfortunately, our eggs still go through this decline, whether it's through day-to-day metabolism, environmental exposures, reactive oxidative damage. We find that these eggs just slowly decline in our ovaries. I have to say that even though risks of pregnancy go up as we get older, our uterus doesn't age as quickly as our eggs. So that's why a woman who requires an egg donor, for example, will still get pregnant in their late 40s quite successfully, following the success rate of the egg donor. However, we know that as we get older, we collect more comorbidities. So women, may have hypertension or have a history of insulin resistance or lead in towards type 2 diabetes even. And so with those background health concerns, pregnancy can be higher risk. So you're more likely to then require closer management in your antenatal care so that you do an early GTT or glucose tolerance test so that your blood pressure is monitored more closely. So you take aspirin for prevention of preeclampsia. So there are lots of things that you can do to alleviate that risk that women face over 40. As you mentioned, it's not all doom and gloom, and I support a lot of older women through pregnancy in an older age quite successfully. However, sadly, miscarriage is a lot more common. And I suppose we can't forget about that aspect of treatment as well, where ordinarily the rate of miscarriage is about 1 in 4 for anyone having a pregnancy. But as you get older, that risk is almost as high as 1 in 2. Wow. And as we mentioned before, that that increases chromosomal problems in the embryo, like Down syndrome or trisomy 13 or 16 or sex chromosome disorders like Turner syndrome, and those things can then lead to a sort of health burden where you have to either go through a miscarriage or decide if you want to progress with a pregnancy. So I suppose we have to come back to focusing on the fact that yes, there are risks, but if managed appropriately with a risk mitigation strategies put in place, and being aware that there could be a higher incidence of premature birth, having the appropriate antenatal care, and taking a step back, having the appropriate fertility management to get you to that point of pregnancy sooner, should still give you a fairly reasonable chance of achieving the beautiful family that you want. Now, Samir, how do you think you can improve your chances of getting pregnant then?
Manny, I think assisted reproductive technology has never been more advanced. We know that, for example, if I take a 36 to 40-year-old patient, her chances of naturally conceiving after 6 months of trying is typically it can be as low as less than 10%. While if the same patient undergoes IVF, their chances of conceiving can go up to between 25 to 40%. Obviously, there's a lot of individual variation, and that's something that, that's a bit of cookie cutter statistic that I've given you, but really would love to have that more specialized and individualized talk that each patient really deserves to have as they start approaching this chapter of their life. You mentioned donor eggs earlier, and donor egg success rates we know can be excellent, and certainly many more, both couples as well as individuals are now choosing to have families this way as well. Freezing your eggs before the age of 40 certainly gives us options as well. And most clinicians would say certainly before the age of 30 improves our chances even further. And that means that you can not only have the opportunity for fertility later in life, but also other decisions or other choices that you might need to do, you can pursue those at the same time. These are obviously conversations, Manny, that many of us would like to have. How do women go about getting that help and getting that information specialized and individualized for them?
So, as we mentioned before, taking that first step to fertility investigation or even meeting a fertility specialist can be quite daunting for patients. And I always suggest that if you are under 36 years of age and have regular cycles with a partner who has no history of, for example, torsion or trauma to the testes or mumps as an adolescent, or any other factor that could contribute to lower sperm numbers, then you should just start by getting to know your menstrual cycle. So, are your cycles regular? When do you think ovulation's occurring? Get one of those tracking apps that you can get online. Start tracking the cycle and timing intercourse. Because as we know, when we release that one egg out of that cohort of 20, as you were describing, we only have 24 hours to catch that egg. And if the sperm's not waiting around for that egg, the egg's like, see you later next month. So we can do a lot to actually get to know our cycle and our ovulation and gauge whether that is regular. Women can even use urinary LH sticks to see if they are ovulating, and start by timing intercourse. Now, if we are under 36 with no other problems, we can safely try for up to 12 cycles before seeing a GP for some investigations, or even then a gynecologist or fertility specialist. If a woman is over 36 and egg quality and other factors are coming into play, where more prudent decisions need to be made in a timely fashion, then I think they should seek help after 6 cycles of trying. So, when you see a doctor or a fertility specialist, normally we can do a few basic tests to gauge where things are at. So, we may go through again your menstrual history, help you to pinpoint if you are ovulating, help you with cycle tracking through the clinic if needed to accurately pinpoint the time of trying. And there are also certain tests that we can do. So, as you mentioned before, Samir, that there's a cohort of follicles recruited every month, and of those, one of them will ovulate and the rest of them will die. So I usually call IVF a rescue mission, where we're actually using a higher dose of FSH to recruit that entire cohort and rescuing them from death. So how do we know your reserve, and how do we know how the brain moderates this recruitment and what number is recruited every month? So our initial pass out of the ovary is genetic programming, and then our pre-antral follicles release the hormone AMH, or anti-Müllerian hormone. And that gives us a gauge based on our age, on a bell curve, whether it's normal, low, or high. And that then kind of predetermines the number or the cohort that is recruited each month, out of which one of them will ovulate. So we can check your hormones to see where the FSH, LH, baseline estrogen sits. We can then also check the AMH hormone level to gauge our reserve, keeping in mind that low AMH does not mean you can't get pregnant. Because in the natural situation, let's say your AMH is 5 when it should be 15, you would recruit 5 or 6 follicles, of which one ovulates. So yes, if we were to do IVF, we would only get the 5 or 6 eggs. But if you're naturally trying and ovulating 1 out of 5 or 1 out of 20, you still have that same chance of falling pregnant following your age-related success rate. So that's important. The second important point with AMH is that it doesn't determine quality of those eggs. No. It only determines a quantitative analysis of where things are at. But it's important to know, your hormones, whether if there is irregularity in the cycle, whether that's from an endocrine problem, or the most common issue could be polycystic ovarian syndrome. If you've got painful periods, then your doctor may help you work through whether you've got endometriosis, which is a whole topic for another day and discussed a lot in the media these days, as well as then doing a pelvic ultrasound to check that the uterus is okay, the ovaries are fine, what is the follicle count. If women have been trying for a little while, some of us may recommend a tube flush or a hycosi, just to check that tubes are patent, so that when you're trying, you know that all the basic building blocks are there to allow conception to occur. And obviously, then it's important to sit down with your specialist and go through these results and investigate the appropriate treatment plan for you. We also then talk about lifestyle measures, dietary factors, supplements required, and all the peripheral things that you can do. And I think the most important thing to remember is don't be afraid. Come and have a conversation. Not all fertility issues lead directly to IVF. There are a lot of other peripheral, simpler treatments that we can tweak to help you maximize your chances of pregnancy.
Look, with so much information around these days, it can be really difficult for people to separate what is fact, what is fiction. And so we're going to address one myth today, and that's a very common question we get, which is knowing when and how often to have sex is a common question couples ask me when they're trying to conceive. And you may have heard in a patient who's got regular cycles that having sex every single day of your fertile window to maximize your chances of conception, that is actually a myth. It's a common misconception. Having sex every second or third day of your fertile window will give you about the same outcome as having sex every day. There was an interesting study that I read that actually found that if women had one episode of sex during their fertile window, 2 days before ovulation proved to be the winning time frame. And that's partly because sperm has a lifespan within the woman of between 4 and sometimes even up to 6 days. As you alluded to earlier, that egg, once it ovulates, has about a 12 to 24-hour window to fertilize, so not a very big window. So in an ideal scenario, that egg comes out in a so-called pool of sperm, should I say, and that really maximizes a patient's chance of actually conceiving in that particular ovulation window.
Another myth or should I say another common question I get from my patients is whether any particular position after intercourse, like standing on their head for 15 minutes, actually improves their chances of conception. Now, that's another myth we need to bust, because sperm are resilient critters. And as you know, there's in the first 5 minutes, they have gone swimming to wherever they need to go to find the queen egg. So there is no reason to try strange positions or stand on your head. And I think it's important to mention that that is a myth. So different positions and not moving after having intercourse is not actually going to increase your chances of conceiving.
I think the foam roller business just went out of business after that comment, Manny. So
now I think we've reached the end of our podcast. Thank you so much for listening today. We hope you found our episode helpful as you embark on your own fertility journey. Samir, thank you for joining me today. It's been a real pleasure having this conversation. Where can people find you if they want to connect?
Yeah, Manny, as you know, I enjoy spreading some educational videos through LinkedIn, Facebook, and Instagram, where people can find me at Dr. Samir Mathur. And yeah, if there's some specialized topics that people are interested in, feel free to ask questions on that, and I might be able to get a reel up on that before they know it.
Great. And likewise, you can find me on Instagram as well as IVF Australia's webpage, where we're all under the specialist section, and we've got videos there so you can get to know us all a little bit better. For all things fertility, subscribe now on Apple Podcasts, Spotify, YouTube. Connect with us on Instagram as well as Fertile Minds to join the conversation. Do you have any fertility questions? Send us a message on Instagram and our fertility experts will answer your question in the next episode. I hope this has been useful. Thanks for listening.